University of Strathclyde, Sir Harry Burns. Sir Harry, thank you for joining us. Do you see a really big division between what they're saying in Edinburgh and what they're saying in Westminster?
Well, I think what they're saying in Edinburgh is actually pretty sensible. I support that. I'm not a supporter of compulsory mask wearing whenever you're out. But what Nicola Sturgeon has said is quite balanced, and it follows the science. To understand this, you've got to realise why surgeons wear masks. I was a surgeon for many years, and we wore masks not to protect ourselves, but to protect the patient. These masks can leak round the edges. They're not like the masks that you see people working in ICU wearing that are fitted round the face and have filters. They're there to prevent the surgeon coughing and sneezing into a patient's wound and so causing a wound infection. So if you think back to the pictures we saw of crowded underground carriages in London at the start of all of this, let's say there were 60 people in there and 4 of them were carrying the virus. By the time they left the carriage, each of them would probably have infected about 3 others, given the reproduction rate that we know. So 4 would get on with the virus and about 12 would get off with it. Whereas if they were wearing masks, that would have largely protected the people round about them from the coughing and sneezing. So I think wearing it on public transport and wearing it when it's impossible to avoid close contact with people is perfectly sensible.
But is she saying Scotland should become, is the Scottish Government saying Scotland should become like some Asian countries where routinely when you leave the house, you wear a mask?
No, that's not what they're saying. They're saying that they should wear the mask when you are in close contact with people, like on a train carriage or in a supermarket where you might bump into folk. I mean, I go out, my 1 hour of exercise a day is cycling and running. I don't get anywhere near people, and it would be silly to force me to wear a mask. I'm not in favour of legal enforcement, but people sensibly should protect others round about them by wearing a mask when they're up close to them. You don't know if you're infected in many cases. So it's sensible to do that. And it's not just not a mask, she's saying, it's any cloth covering of your mouth and nose. It could be a scarf or a T-shirt or something.
Looking at the public health decisions that's been taken across the whole of the UK, do you think it is possible to say that at the beginning of this outbreak in late February and early March that we were simply too slow across the UK in imposing a shutdown?
I think so. I think after previous outbreaks in the Far Eastern countries, particularly places like South Korea, were much better prepared. They had stockpiled things. They were ready to do testing and tracing and so on. Whereas I think initially there was a feeling, well, this is the other side of the world that's not going to affect us. I think we underestimated just how infectious this virus is. And highly infectious viruses that kill a lot of people, almost by definition, they have spread widely in the population amongst people who maybe have very mild symptoms. So that's why mask wearing in close contact with other members of the public makes sense.
Now, across the UK, we're going back to a testing programme, more and more tests being offered. In the present circumstances, is that going to be an effective way of curbing the outbreak, and if so, how?
Well, testing itself just tells you who's carrying the virus. It's what you do after that that's important in curbing the spread. If that person is carrying the virus and is asymptomatic, if you can find out who he or she has been in close contact with and get them to isolate and tested and so on, then that begins to shut down the spread. This reproduction number, initially every one person is affecting 3 others and so on. If we get that down as close to 0 as possible, then the infection will die out. And we get that down as close as possible by testing, tracing the contacts of the positives and getting them to self-isolate.
So the follow-up is what's really important.
Yeah, absolutely. And that's why people are inventing bits of software for your phone that will tell them where you've been and so on, and you can contact others who've been in close contact. It's all about supporting people and stopping them getting ill. And unfortunately, a significant number are getting very ill and dying.
So Harry Bounds, thank you very much indeed for joining us.